Hello, welcome back to this channel where we talk about the basic medical information making a difference. Kindly, for those ones who have just come across this channel for the first time, consider to subscribe because subscription is free. The returning subscribers, thank you so much for always coming back to check on this channel. I go by the name Rebecca Morangi, and this is the best place to be. Give the video a like before we start and kindly watch the video till the end. In the last video we did on how the urinary tract works, we promised to narrow down and look at the urinary problems one by one. And today we are going to look at a common urinary tract problem which affects many people, young and even the adult generation. This is one of the videos you should never miss. The health problems that affect the urinary tract differ between men and women, both in the symptoms that are suffered and in the underlying causes. If we can do just a recap of what we learned last time, we said we are going to use our structure here, which will make us understand it's good to get to master the parts of the urinary system. And kindly, I request you to go back and watch the first video we did so that you get to know more about how the urinary tract works. And if we can do a recap on this structure, the two kidneys, its major work is to remove chemicals and excess water from the blood which passes through them after being fed by several small arteries. And the excess water and the chemicals now drain out via the ureters. These are the two ureters I'm talking about, running down from the kidneys. Now the urine travels through the ureters down to the bladder. This is the bladder here, and the bladder we mentioned the major function, it works as a temporal storage. After the bladder is fully filled, that is when we feel the urge and go to relieve the bladder or to relieve ourselves. We have the urethra. The urethra is the tube which extends from the bladder down to the genital area. Its major function is to carry urine from the bladder out through the genitals. The male urethra is longer, remember that. It's like 10 inches long as compared to women, which is shorter, like 1 inch. And that is why women are more susceptible to urinary tract infections. We have the sphincter. The sphincter muscles, they surround the bladder, which its major function, it governs the opening and closing of the bladder. And actually it's controlled by the brain, allowing us to choose the time to urinate. So after going through that, I'll be mentioning these parts as we move on. Today, the first urinary tract problem we are going to look at is what we call discomfort during urination. How does it come about? What are the symptoms? How the problem is diagnosed? The treatment? Are there complications? And also how we can prevent them. If you feel pain or a burning sensation when passing urine, bacteria infection is most likely the cause. Discomfort during urination is mostly what we call urethritis and cystitis. And these are very common urinary tract infections. In other words, we call them lower urinary tract infections. What we are supposed to bear in mind, urethritis is the inflammation of the urethra, that is the tube which runs from the bladder down to the genital or the genitalia. This is where the problem mostly affects, which is the tube which carries urine from the bladder out to the genitalia. While cystitis, on the other hand, is the inflammation of the bladder, which causes pain and discomfort in the lower abdomen. And the symptoms can be similar. Again, the symptoms can differ in some cases, depending the part of the body they affect. What are the symptoms then of these conditions? The urethritis and cystitis. 1. Pain and a burning sensation during urination. Frequent urination, having a cloudy or strong smelling urine. Blood in urine, what we call hematuria. Strong persistent urge to urinate. Penile discharge, which can be in form of pus, and also pelvic pain. Those are the symptoms which mostly appear in somebody who has got this condition, either urethritis or cystitis. Bear in mind, urethritis, it's the inflammation of the urethra, this tube running down from the bladder to the genitalia, and cystitis is the inflammation of the bladder, and which causes pain in the lower abdomen. Other symptoms are similar, but the major difference is the part of the body they affect. And when we mention of inflammation, this is where some part of your body becomes swollen and feels hot. So that is where the discomfort comes from. Urinary tract infections mostly affect all and very common in women than in men because of the anatomy. But men are less likely to develop the urinary tract infections, but they are more likely to develop the complications from urinary tract infections than women. That is an example of kidney infections. Urethritis can also be transmitted through what we call sexual contact. Up to this point, I believe you have heard the major difference. Kindly keep on getting this information because information is power. Share the link, and by sharing the link means that you are considerate. Give the video a like, and let's meet in the next part. We are going to look at the risk factors of the urinary tract infections, especially urethritis and cystitis.